Nausea is one of the more unpleasant aspects of chemotherapy treatment. The side effects of chemotherapy depend on the type of chemotherapy, and of course the amount given. Just as everyone's medical profile is different, so too is everyone's response to chemo treatment. Some people get major side effects, and some have very little. You need to discuss with your care team any possible side effects, if you haven't yet started chemotherapy. Nausea can seem like a purely physical reaction, but what your mind expects to experience has huge implications on the intensity of nausea, or even whether you experience any nausea at all. There are two different types of nausea associated with chemotherapy. Firstly, there is what is called anticipatory nausea. Some patients feel nausea in anticipation of the next treatment. They have been so conditioned to associate certain triggers, such as the smell of a hospital or the sight of a medical uniform, that these triggers alone are enough to make them nauseous. This is one reason we use hypnosis. A stage show hypnotist will suggest to the subject that upon a certain trigger, such as the hypnotist using a certain word, the subject will produce a certain response, such as strongly smelling roses. So the subject experiences something that seems real, without even being exposed to roses. This is exactly how anticipatory nausea works. It's actually a naturally occurring hypnotic response. That's how powerful hypnosis is. Part of this hypnotic experience will teach you to relax in response to triggers that before may have automatically resulted in nausea. We aim to unhook these associations so they no longer prompt nausea. The second part of the nausea experience is the physical reaction that occurs within 24 hours of administration of the chemotherapy. This can be very mild, moderate, or sometimes severe. Medications such as haloperidol may be given in isolation, or in combination with other medications, to prevent or treat nausea. However, this can still be partly to do with anticipation. Anyone can get ill, but it's also true to say that your mind has strong sway over your body. Your brain controls nausea and vomiting. Nausea is controlled by autonomic nerves, which control involuntary bodily functions such as heartbeat and breathing. Different irritants such as smells, tastes, anxieties, pain, motion or chemicals can trigger a vomiting center in the brain to initiate the vomit reflex. Hypnosis is a natural way of influencing autonomic functions in the brain. For example, hypnotized subjects can often influence healing rates, skin temperature and pain levels. All things which are usually not under conscious control. During the focused hypnotic trance you can really learn to calm down responses, and change instinctive reactions. Yogis do this when they lower blood pressure at will, or slow heartbeat rate. Download your Reduce Chemotherapy Nausea session today, and start to feel more comfortable. Please note that if you purchase this download, all proceeds will be donated to our charity. However, if you are suffering from cancer and cannot afford to buy the download, please contact us for a free copy. Click the link below this video if you would like to know more.